Men are manly. This is what makes us men. We even fight kangaroos when the occasion calls for it. And when you're a man, you will have a prostate. And when you have a prostate, you can end up with a major pain in your... Prostate is an important organ for everything we men do, from peeing to procreating, and it is the center of the #1 cancer risk for men, so it is kind of a big deal. For most men, at least until you get into a few decades under your belt, the biggest issue with your prostate can be that extra attention that the doctor gives you at the end of your physical. Yes, the prostate check. It's an exhilarating experience that has sparked loathing, fear, countless jokes at our expense. Heck, even snowmen aren't immune to the issue at hand. You get it? The issue at hand? Alright, moving on. Word prostatitis is formed from the root word prostate, meaning prostate, and itis, meaning inflammation. You'll notice that there is no combining vowel in this case. And the word defines the general condition of prostatitis, an inflammation of the prostate. When you suffer prostatitis, the prostate can become inflamed and enlarged, and the swelling of the organ can cause discomfort or pain, create difficulties during urination, or you may not notice it at all, quite honestly. It can be caused by a number of factors, including infection, abrasion from medical procedures or rectal intercourse, or from an enlarged prostate. The condition can be acute or it can be chronic, and there are a number of ways to treat the disorder. These include anti-inflammatory drugs, antibiotics, muscle relaxants, or any number of prescription drugs called alpha blockers like Hytrin, Flomax, or Repaflo, all designed to reduce symptoms and improve urine flow. Lifestyle changes, including reducing coffee, exercise, and improved diet, can also work to improve prostate health. Prostatitis is very treatable and very, very beatable. So next time you ready for your annual physical and it comes around, we should all look forward to the opportunity to make sure that everything is in perfect working order. Well, no, we probably won't look forward to it. On this episode, we're going to be discussing our kidneys. Our kidneys are important players in maintaining the health and well-being of, well, our entire being. They extract waste from the blood, they balance bodily fluids, they support the heart, they form urine. I mean, they basically are pretty much just like little superheroes that just float around doing wonderful things for everybody else just because it's the right thing to do. Well, like the rest of our bodies, they are resilient. However, they are also fragile, and they can suffer a multitude of disorders that can put a big hurt on the dynamic duo and the body as a whole. One of the more interesting afflictions of the kidneys is called nephroptosis. It's an ominous word from the root nepher, meaning kidney, our wonderful combining vowel O, and ptosis, meaning drooping, sagging, or prolapse. It's also commonly known as the magical floating kidney, which is basically another way of saying it's the kidney's slow but purposeful attempt to escape and make its own way in the world. You know, where it's going, what it intends to do, I don't know. Maybe it wants to be an artist, maybe it wants to run away with the circus, or maybe, like many of us, it just wants to be a rock star. I'm not sure, but clinically speaking, nephroptosis is defined as a condition where the kidney descends more than 2 vertebral bodies, or roughly greater than 5 centimeters. This, of course, puts a lot of pressure on the many vessels that supply the kidneys with their blood and take things away, and it also causes a variety of pain and secondary injuries to the organs and any of the supporting vessels. The mobile kidney was first described in the 13th century by Franciscus de Pedemontanas, which I'm pretty sure this is probably not him, but it could be. It was generally left untreated. Now, in the mid to late 19th century, nephroptosis began to be identified with general symptoms of acute abdominal pain and vomiting, and typically nephrectomy, the removal of the troublesome kidney, was the treatment of choice for this particular problem. However, because the treatment more often than not was killing the patients, doctors decided, thankfully, to try to find a different way of doing things. Well, in 1882, Eduardo Bassini this is actually the guy, pioneered the use of fascial sutures to affix the wayward kidney to the retroperitoneum, which basically means kind of the wall of the abdomen behind the peritoneum. And thus, the kidney stays in place, and the prodigal kidney gets to stay home, and it has to learn to live with never seeing the Golden Gate Bridge or traveling and seeing Mount Rushmore. Or really, this is the end of a sad, sad tale of unrealized kidney liberty. Hemophilia used to be considered the royal disease because so many European monarchs seem to be having so much trouble with it. Well, as it turns out, it's a genetic disorder, and the matriarch of several of these families was Queen Victoria of England. Several of her children were married into the royal families of other nations, and the genetic trait for hemophilia just followed them around. One of the more famous examples of this is Russian Tsar Nicholas and his family. The word hemophilia is not made up of word parts per se, but you can break it down into the prefix hemo, which means blood, and the suffix philia, which generally means fondness. It is possible that the rumors of interbreeding royal folks probably played a role into the formation of the word. Hemophilia is a medical condition in which the ability of the blood to clot is severely reduced, causing the sufferer to bleed severely from even a slight injury. The condition is typically caused by a hereditary lack of coagulation factor. Our blood usually has a bunch of clotting factors, and they all play some role in making sure that, well, this doesn't actually turn into this. There are several types of hemophilia, and they are classified according to which clotting factor is deficient. Hemophilia A is the most common type. It's caused by insufficient clotting factor 8. Hemophilia B, the second most common type, is caused by insufficient clotting factor 9. And hemophilia C, in which the signs and symptoms actually are fairly mild, is caused by insufficient clotting factor 11. Small cuts aren't usually much of a problem. The greater health concern is deep bleeding inside your body, especially in your knees, ankles, and elbows, bruising. That internal bleeding can damage your organs and tissues and may be life-threatening. The primary treatments for hemophilia are regular infusions of clotting factor. The clotting factors that you're missing are put back in your system, and they can help prevent bleeding before it even becomes a problem. In addition, you have clot-preserving medications, antifibrinolytics, and these medications help prevent clots from breaking down once they have formed. While there's no cure for hemophilia, most people with the disease can lead fairly normal lives, even if you aren't royally famous. So one particular Easter holiday, your Cottontail was hopping down that famous bunny trail, just kind of minding his own business, when all of a sudden, his left foot burst into flames. Well, not really. Now he's dealing with an intense pain in the bottom of his left foot. Well, being a real trooper, finished his rounds so that, all the world's children can have their holiday candy and ensure that the Tooth Fairy has plenty of work to do as well. But Pete is in a lot of pain, and so he goes to a podiatrist and says, "Hey, what's wrong with my foot? Is it a nail? Was it a particularly rough patch of crabgrass? What am I dealing with here?" The doctor just smiles and tells Pete that more than likely he's dealing with a little bit of plantar fasciitis. Plantar fasciitis is made up of two words. Planta being the sole of the foot, and R meaning pertaining to, and then fascia meaning a band, and itis, of course, meaning inflammation of. The plantar fascia is a thick band of tissue that connects the heel bone to the toes, and it can be caused by any activity that puts stress on the bottom of the foot. It is very commonly caused by repetitive motions, such as hopping down a trail. In extreme cases, surgery may be the only option, but in the case of plantar fasciitis, the surgical goal isn't to reconnect the bands. Rather, the general plan is to detach the fascia from the heel bone entirely. Plantar fasciitis can be treated with a variety of anti-inflammatory drugs, physical therapy, and special shoe inserts that can provide extra cushion and support. Ultimately, a little rest can go a long way. So after taking a few weeks off from hopping, and after a few trips to the physical therapist, Pete is back to his hippity-hoppity self.
You wake up on the
For the record, this is a gourd, not GERD. Talking about a palace guard, although that's a fairly serious-looking fellow. It's not even about Dr. Gerd or his patient. Spoiler alert, he marries her at the end. We're talking about GERD. It is an affliction that around 60 million Americans deal with on a part-time or full-time basis. Like this woman. Or this guy. This woman. Oh, she looks uncomfortable. Heck, they even think babies suffer from it more than we ever thought. Unlike the bird, GERD is not a word. It is an acronym. That acronym stands for gastroesophageal reflux disease. It is a condition in which the sphincter that separates the esophagus from the stomach doesn't close properly, allowing stomach contents to flow back into the esophagus. Now, left untreated, it can gradually break down the mucus barrier of the esophagus, and that would be bad. Heartburn, also called acid indigestion, is the most common symptom of GERD. It usually feels like a burning chest pain beginning behind the breastbone and moving upward toward the neck and throat. This burning and pressure or pain of heartburn can last as long as 2 hours, maybe even longer, and it's often worse after eating. Sometimes when you lie down or bend over, it can also result in heartburn. If you have chronic trouble with heartburn or other GERD-related symptoms, you should definitely go and see a gastroenterologist. The first thing you're going to do is they're going to look at your lifestyle. They're going to look at things like daily eating habits, the types of food that you eat. They'll most definitely tell you to quit smoking, and they'll probably tell you to lose some weight. If medications are called for, there are two types. First are H2 blockers, and these inhibit acid secretion in the stomach. The H2 blockers include cimetidine, which is also called as Tagamet, famotidine, that's Pepcid, and ranitidine, that's Zantac. I'm sure you've seen all these on TV. Another type of drug is a proton pump inhibitor, and it doesn't have anything to do with Star Trek, although that would be really, really cool. Now, proton pump inhibitors are drugs that reduce an enzyme in the stomach that's responsible for acid secretion. Some of those drugs available are esomeprazole, which is Nexium, lansoprazole, which is Prevacid, and omeprazole, which is Prilosec. With the combination of lifestyle changes and the right medications, most people can still enjoy some of the finer things in life. Within reason.